So, Namaskaram. Good afternoon. Good afternoon. See, when we discuss various Ayurvedic aspects, our Manovaha Srodhas should be very Tishna. I think your Annavaha Srodhas is now Tishna. Am I right? Manda Guna only. Am I right? Yes or no? What is yes? Your Annavaha Srodhas is Tishna or Jnanavaha Srodhas is Tishna? You are lying. Okay, anyway, so we have heard enough presentations regarding the various aspects of neurodegenerative diseases in Ayurveda. So actually, I am going to present something which is different from the previous Alzheimer's, Parkinson's, because we have discussed them very well. So since the most of the audience are coming to the junior doctors level, I will be giving some different thoughts of neurology based from my humble clinical experiences. Before entering into the slide, brain, the treasure house of unfolded secrets. You know, before getting the MRI, before getting the CT scanning, it was very difficult to have a precise diagnosis over the multiple cases where there is structural anomaly. My dear doctors, Ayurveda is a science which is always built upon the concept of functional anatomy. We always discuss with the Vada Vyadhi, but we can never see what is Vada. We can only see whenever there is a dystrophy, whenever there is an atrophy, whenever there is a space-occupying lesion in the brain, we are telling that there is Vada Vyadhi. Vada is always Amurta. So Ayurvedic entire concept of Ayurveda is built upon the concept of functional anatomy, and this functional anatomy, so this functional anatomy is always important. That is why some of the time we will be finding it difficult to exactly locate the pathology of Vata Vyadhi in Ayurveda. So my humble initial word is always have a very strong understanding of the Ayurvedic concept of various Vata Vyadhi. Then only you can go to the higher levels of exploration. That is my humble initial request. Next slide, please. So exploration of Ayurvedic neuropathology based on certain clinical experiences, that is the topic. This exploration word is always important. Everybody know what is Dadushaya, everybody know what is Avarana, but is something beyond that Dadushaya and Avarana which finds it very difficult to understand Vata Vyadhi. That is why Vata Vyadhi is the number one among the Ashta Mahagada. You know, Vata Vyadhi, Ashmari Kushta, the first disease is Vata Vyadhi only. Next. So today's motto, from the text to word to word. No, we study so many things from the science, that is word. Word is from the Shastra. I want you to take you to word. Word means where we are getting the patients. So the only difference from word to word is O to A. Am I right? Only one difference is O to A. What is O? What is A? O means an opportunity in the Shastra. A means action to be done in the practice. That is my understanding. Each sloga you are studying in Ayurveda, each sloga you are by-hearting in Vata Vyadhi is an opportunity only. Until and unless you are not bringing that opportunity for the action, for the treatment, for the benefit of the public, for the benefit of the patient, there is no need of Vata Vyadhi Adhyayam Vyakyasyamaha Idigasmahu Ratrayadayo Magarshaya. My humble request, so whatever sloga you are studying, I will tell a simple example. Ababakwe hidam nasyam snegascha uttara bhaktiga. When somebody is getting with a brachial neuralgia, when some patient is brought to you with difficulty in raising the hand with brachial neuralgia or Vishwaji, you prescribe Rasna Dashamula Gridam after food, respecting the sloga Ababakwe hidam nasyam sarpar uttara bhaktiga. You give the grida after the food, and Rasna Dashamula Gridam is a grida which is mentioned in the Kasa Roga Chikilsa, not in Vata Vyadhi, not in any complicated chapter, simple Kasa Roga Chikilsa, Sarvanga Eganga Rogamscha, Sapliha Urtva Anilan Jayet. My dear doctors, when you by heart this sloga from Kasa Roga Chikilsa, there is a grida called Rasna Dashamula Gridam, which can be given for Urtva Anila. And understand that all the pathology, so the Ababahuga, you are getting Urtu Anila, and then take the pen and confidently write Rasna Dashamula Gridam after the food and salute to the sloga Uttara Bhaktiga. So never simply by heart sloga, whatever by heart, there is a patient. For every word in the text, there is a word. For every sloga in the text, there is a patient. So that should be the link. Then only you will feel that theory and practice are both interconnected, interrelated, and anyonya avarana. No, anyonya sahaya. So that should be the concept. O to A. That is my clinical responsibility from opportunity to action. Please, next. Clinical diagnosis and management is a brain game. A right move at the right time make you the right physician. The word right is important. Every time you should not delay the patient. I will tell another simple example. Whenever you are getting a patient with a coma, in Ayurveda we often tell that there is no treatment for coma, but I have an experience in Trivandrum Ayurveda College. One of the Panchakarma therapists who was doing Sedana Karma suddenly collapsed. There was no increase in BP, there was no other change, there was no treatment immediately available. The patient collapsed in the Panchakarma theatre Trivandrum only, doing Vadavayapa Chikitsa. See, the patient was doing Vadavayapa Chikitsa to somebody else. The immediate available drug was Villwadi Guliga. The immediate available drug was Villwadi Guliga, and you very well know Villwadi Guliga is indicated in the Visha Chikitsa. In the Saptama Vega Visha, it is mentioned that you do Anjana and Nasya. And Villwadi Guliga, it is clearly mentioned that Swasti Garodi Anjana Pana Nasya. We went for nothing, we took a straw which was used for drinking the juice in the nearby room. We took the straw, we cut into two pieces and made the Villwadi Guliga powder and inhale, and suddenly it was sprayed into his both nostril, equivalent to Dhmana Nasya. You know what is Dhmana Nasya? Dhmana Nasya is the Nasya done with Viredana Churnai. Villwadi Guliga was converted into a powder and used as Dhmana Nasya. Patient immediately got the wake up and he was admitted to other hospital for further management. I am telling Villwadi Guliga mentioned in Ashtangradayam Uttarasthanam Visharoga Pradesheda was judiciously, timely applied to a patient who became unconscious. And Swasti Garodi Anjana Pana Nasya, that sloga was respected. Are you getting me? Villwadi Guliga Phalasruti, everybody know, everybody by heart the sloga, singing the sloga. And you are not at all using for the practice, there is no benefit. Swasti Garodi Anjana Pana Nasya. That was the reference for the Villwadi Guliga. Application was in coma. Coma is not supposed to be there in the part of Vishajigilsa, but we have got result. This is what I am telling. Small clinical experiences supported by basic theory will every time take you to the higher level of understanding. So for the next time when you are getting a patient with a sudden coma, think about Dhmana Nasya with the Villwadi Guliga. As soon as the patient is getting the consciousness, immediately prescribe Lesuna Sorasa in Tila Taila. Lesuna Sorasa in Tila Taila will remove any possible transient ischemic attack. I am telling you a simple story which occurred in Government Ayurveda College Trivandrum 5-6 days back. When I was sitting in the OPD, my students came and told that, sir, one of the patient is having 210 and 120 diastolic pressure, 210 systolic, 210 systolic and 120 diastolic. We went to the patient. In front of us only the speech is becoming slurred. And he is getting all the problem. Nothing was there. Immediately we could think something about Siddha Nagavadi. Siddha Nagavadi was available in the drug bank of the house surgeon's room, and we took Punarnavasavam and Ashwagandharishtam. We need something Vyavai, Vigashi to take the medicines immediately to the controlling center. So the available Punarnavasavam, Ashwagandharishtam was mixed, and we could save the patient from a transient ischemic attack. But we didn't keep him there. We referred them. Patient was not ready to go to the general hospital because he is getting okay. But we told there is a transient ischemic attack. There will be secondary stroke attempt will be there, and they underwent angiogram. 3 blocks were detected. 3 blocks. So I am telling you, because you can manage something but never simply think that you can do everything. We sent for better management. They done the angiogram and 3 blocks were there. Now he is under modern medical treatment. So I am telling all these stories simply because there will be some scope for Ayurveda. There will be some area where we may not be able to do the utmost thing. The word right time is important. So this is my first sharing of experience to you. The word right, that is always important. Next. I am not going to the detail. Any pathology which is occurring in the central nervous system, in the brain, in the spinal cord.
Here is an announcement. Those who are participating in the poster presentation competition, The numbers 32 to 52 are said to be reported under post-presentation venues. The numbers 32 to 52. 32 to 52.
Okay, so that is the announcement. We will come back. So every time when you are getting a central nervous system pathology, you have to always think about the Sushma and Stula Rektabaha Srodoroda. I am always telling you, never simple limit your reading in Vadavyadi. Go to the Sannyasa. The very important area which you have to explore is Sannyasa. And when you are getting a pointer, any pointer something? Any pathology which is occurring in the peripheral nerve, you have to think about the Upadadu Pradoshaja concept. I will be telling with an example. When you are getting a thrombus or embolism or any CVA, the primary thing is Siragraha. There is a disease mentioned Siragraha in Ayurveda. Most of the people are ignoring it. What is Siragraha, my dear student? Siragraham. Please, anybody, any Kayagilsa PG scholar? What is Siragraham? Siragraham is the disease mentioned just before the Pakshagadam. Everybody study the sloga Grihitwardam Tanor Vayu Sirasnayur Vishoshtija. Before that there is a sloga Rektam Asritya Pavanaha Kuryal Murtadara Sira Yutshasa Vedana Krishna So Asadhyasa Siragraha. Now I will put the replay. Rektam Asritya Pavanaha Kuryat Murdadara Sira. The direct mentioning about a cerebral blood vessel in the entire Ayurveda is Siragraha only. Please read Ashtangradayam Nidanasthanam Vadavyadi, the sloga just before Pachagada. Everybody study that sloga because Guhas will ask in examination. This sloga nobody will ask. Rekta Masritya Pavanaha Kuryal Murda Dara Sira. Whenever there is the involvement of the Murda Dara Sira, my dear friends, my dear doctors, the word Murda Dara Sira is nothing other than cerebral blood vessel. And when it is attacked by Vada, the clinical feature is Rutshasa Vedana Krishna. The Sira will become Krishna. You know the necrotic changes. Whenever there is an infection, the surrounding area will be getting Krishna Varma necrosis. That is Dhatu Bhaga. Even without an MRI, even without a contrast MRI, Ayurvedic Acharyas centuries back told the pathology of a cerebral blood vessel, directly telling Rektamasritya Pavanaha Kuryal Murta Darasira Rutshasa Vedana Krishna So Asadhyasya Siragraha. Next slogam is Pakshagadam Grihitvartam Tanurvayu Sirasnayur. I always tell you Sirasnayur Vishosya SSV. You make the new abbreviation Sirasnayur Vishosham SSV is similar to CVA. We never write CVA. If we are writing CVA, they will understand. If they are writing CVA, we will understand. But if we are writing SSV, they will never understand. Is it possible? I am not lying. I am telling from my classics. I am telling from my Mahabharatam. I am telling from my Ramayanam. I am telling from my Bible, my Quran. Sira Snayur Vishoshya. What is Sira? Sarana Sira, all vascular compartment. What is Snayu? All neurological compartment. The two words Sira represents the entire vascular component. Snayu represents the entire neurological component. All the neurological issues are vascular complications only. That is why I am telling you, always explore Rekta Vitta Chikilsa. When you are getting a cerebral hemorrhage, Urdhaga Rekta Vitta Chikilsa is that much important. There is a wonderful reference in Chakradatam. I am telling only the clinical matters because there is no time for all fundamental slides. Whenever there is Urdhaga Rekta Vitta, there is a reference mentioned in the science called you apply the Triphala Kalkam with the Chandanam as a labana in the shaved head. Shiro Leba, the next word is Seduriva Toyavegam Runati. Seduriva Toyavegam Runati. It will prevent the bleeding in Urdhaga Rekta Vitta. Most of the time we believe Urdhaga Rekta Vitta is Nasa Akshi Karna Asir. Am I right? Urdham Nasa Akshi Karna Asir. When there is a diabetic retinopathy, whenever you are getting a bleeding pathology in the eye, we always prescribe the medicines for Urdhaga Rekta Vitta. I am telling you, whenever you are getting a cerebral hemorrhage, subarachnoid hemorrhage, some of the treatment principles mentioned in the Urdhaga Rekta Vitta Chikilsa, example, Triphala plus Chandana Shiroleba can be judiciously done in the proper time. So my humble sentence is, you never limit your search of Vata Vyapa Chikitsa neurological treatment only in the classical Vata Vyadhi. You go to Rektabita, you go to Sannyasa, you go to Madatya, and even you can go to Kasa Roga Chikitsa where you are getting Rasna Dasamula Gradam. Because every chapter there is an element of Vada, Vivitva, Dashugaritva. It is always Vada is respected. So every time when Vada is there, somehow this loga. I will tell another simple example. In Adisara Chikitsa, you are getting the Anuvasana Taila whenever there is a Pakwashakata stage. And in such a stage of Pachagada also, we are doing the same Anuvasana mentioned in the Arshas. Because in Arshas, you are getting the pathological involvement of all the 5 Vayus step by step. Am I right? Apana, Samana, Vyana, Udana, Prana are getting equal importance, and there is a complication called Udavartam. The last complication of Udavarta is nothing other than Buddhi Indriya Uparodham. Buddhi Indriya Uparodham is the involvement of the higher mental function that is mentioned in Udavarta, the disease which is mentioned in Arshoroga Chikitsa. Durnamnamit Udavarta Paramo Ayam Upadrava. You do Pipalyadi Anuvasana Tailam, you administer Takra Prayoga with the Chitraga. We got a patient of M&D. That is ALS only, amyotrophic lateral sclerosis, and the treatment suggested at the end was, we took the Chitraga and it was made purified by the so-called lime water soaking, and then Chitraga powder was applied inside the mud pots. Chitraga powder was applied in the mud pot and Takra was poured, kept for 1 month and given to the patient. The reference is from the Shostaroga Chikitsa. Takram Masas Tidam Tattu Divanam Kapababajit. Chitraga is a potent drug to be given in chronic Vata Vyadhis. You go to Ashtangradayam Rasayana Chikitsa. For every experience, I am telling the concerned sloga. For every experience, I am telling the concerned sloga. You go to the Ashtangradayam Rasayana Pragaranam Chitraga Rasayanam. At the end of the Rasayana, there are 2 lines. Tailena Lidua Masena Vadan Handi Sudusturan Mutrena Chitra Gustani Pidas Takrena Payujan. You take the Chitraga Churna and give it with the Taila in Vada Vyadhi, which is Dustara. You take the same Chitraga Churna and give it with the Mutra in Chitra Gusta. You take the same Chitraga Churna with the Takra for the Arshas. You are getting 3 important Mahavyadhi. You are getting Arshas, you are getting Kushta, you are getting Vada Vyadhi with a single drug Chitraga. Simply because Chitrago Dibana Padana, Koshtagata Padana, Madhyama Roga Margaga Padana. So Chitraga is Dibana Padana, Chitraga is Rasayana. So that is my point. For every clinical condition, there is a concept in the science that is to be always explored. So my point is, every time when you are getting a central nervous system pathology, go to the Sannyasa, go to the Rektabita, go to the Madatya, go to the Kasaroga, go to the Shostaroga, and then go to the Vata Vyadhi. There are wonderful references regarding the treatment of Pachagada in Vishamajwara Chikitsa. Treatment of Pachagada is mentioned in Vishamajwara Chikitsa. It is clearly mentioned that you give Thailam. You give Thailam with Lesina Surasa in the early morning, followed by Kalyanagam, Panchagavyam, Tiktagam, etc. That is very much applicable to the management of all obstructive thrombotic pathologies of brain. So that is there. And when you come to the peripheral nerve issue, where you are not getting any serious complication, you are getting only peripheral neuropathy, you are getting only bilateral distal polyneuropathy, peripheral neuritis, carpal tunnel syndrome, minor pathology, Ubadadu Pradoshaja Vyadhi concept. You please respect Charaga Subadadu Pradoshaja Vyadhi concept. He told it very detailedly. Snayosthira Kandarebhya Dushta Krishnandi Manavam. You follow the next line. The entire neurology will come in a single line. The entire neurology of Hutchison, Davis and Harrison will come in a single line. Stamba, Sangoja, Kallipur, Grandhi, Spurana, Suptaya. Stamba, Sangoja, Spurana, teaching, fasciculation, numbness, everything is attributed to the symbol concept that is called Ubadadu Pradoshaja Vyadhi. When you are getting an Ubadadu Pradoshaja Vyadhi, Snava Sandhi Sira Prapte, Sweda, Daha, Upanahana, like treatments are important. So that is the judicious combination of CNS and PNS in the pathology. Okay, please next. So now I am telling you Ayurvedic neurology. It is a new term. You can see different Samprapti domains, Vadadika pathology, Kapha and Pitta have equal role to play. Whenever there is a Kapha contribution, there will be always dhatu gata mala sanchayam. I am telling without any doubt that when you are getting the accumulation of some unwanted metabolic waste, we call it as dhatu gata mala sanchayam, and all the sanchita malas behave equal to kapha. All the sanchita malas behave equal to kapha, and that is called kapha varanam. You never think that avarana will occur only in a long tube. What is our concept? There is a long pipe, and inside there is a block, we call it as avarana. In a simple cell also, if you are getting an unwanted protein, we can call it as avarana, because ultimately this foreign body will destroy the entire functions of the cell. The entire functional harmony of the neuron will be destroyed by the inclusion body. Say for example, amyloid protein, beta amyloid protein, synuclein protein, syn alpha protein, all these things are kapha only. And what about pitta? You can see whenever you are having a dhatu paga in brain. I use the word dhatu paga in brain. The best example is transverse myelitis. You are getting transverse myelitis, that is a gradual phenomenon of paga only. When there is paga in the Madhyama Roga Marga, it will be leading to a sequelae where you are getting gradual degeneration. So, kapha and pitta will behave dhatu-gata mala sanchaya and dhatu bhaga in CNS. But unfortunately, every time we will tell only one important concept, that is dhatu shayam. Dhatu shayam is the last stage. Dhatu shayam is the irreversible stage. Dhatu shayam is the stage where there is permanent irreversible deformity. There is no more treatment at all. All avarana, if left untreated, will be ending with dhatu shaya only. So always respect. Another important concept we are giving less importance is Agni. We always give importance to Agni in all GAT disorders. I am telling you by quoting from Grahani, Aharam Agni Pajadi, Dosha Nahara Varjide, remaining. Kshinan Dhadushu Dosheshu, Jividam Dhatu Samshaye. All the autoimmune diseases, all the diseases which will be leading to chronic Dhadushaya are the product of Dhadushaya, and this Dhadushaya is occurring due to Dhadupaga only. That is why, my dear doctors, to prevent Dhadupaga, Girda Kalpanas are always praised in the neurological disease. Dhatu Paga is a Pitta phenomenon, Pittasya Sarpishapanam. That is why Kalyana Girda, Brahmi Girda, Gugulita Girda, Vidarya Girda, Rasnavasamala Girda, Karaskar Girda, every Girdas are having that much of upper hand in the neurology. One more important point, we always blame Vada. Poor Vada. We always blame Vada. Vada Vyadi. See, Vada Vyadi only, no Vada Swastyam. We always blame Vada Vyadi. We are not telling Pitta Vyadi, Kapha Vyadi. Actually, all problems are caused by Pitta and Kapha only. Kapha will make Avarana, blame will go to Vada. Pitta will make Dhatu Bhaga, blame will go to Vada. Simply because there is one slogan in our hand, Pittam Pangu, Kapam Pangu, Pangavo Maladhadava, Mayuna Yatra Niyandi. But remember, without controlling Dhatu Bhaga, there is no treatment in transverse myelitis. Without controlling and minimizing the elementary contribution of beta amyloid protein, there is no treatment for Parkinson's disease. Both the treatments are given to Kapha and Pitta, not to Vada. So that is to be the fundamental understanding. Specific level and type of Srodho Dushti, involvement of Dhatu and Upadhatu. See, there is no mentioning of a Dhatu in Pachagata Samprapti. You read the sloga. So the teachers will come to the Viva and tell, what is the Dushya in Pachagata? Even Bhagbada doesn't tell. Then how a student will tell? Grigi Twardam Tanurvayu, Sirasnayar Vishoshaja. Sirasnayu is mentioned. Am I right? And then some intelligent student taught by an intelligent teacher will tell, Sir, Sirasnayu represents the Rasa Rekta, Ubadadu, or circus. No. The real Dushyas in Pachagata is mentioned in the previous sloga. I told you, Siragraham. Whenever there is a Rasa Dushti, that Rasa Dushti will be leading to Srodho Roda in all blood vessel. Paichilya, the Gaurava Dravyam Rudhva Rasabaha Sira, Datte Yat Gauravam Tasyat, Abhishandi Yadadadi. My dear doctors, please respect the concept of Abhishandi, Rasamula Vahanam, Srodasam, Hrudayam Moolam. You are getting a coronary artery disease. The best sloga in the neurology, the best sloga in the Vada Vyadi is Apadandraga only. Today itself you go and read Apadandraga 100 times. I am telling you, Avadandraga, 101 Avarti, you read the best disease where you are getting Shirashangauja Pidayet. Shirashangauja Pidayet, and the Samprapti is in the Hridaya only. The one and only disease where the samprapti is in the hridaya, the pathology is seen in the shangam. Shira shangam. The word is very clear. Adaka pratikado vaya prajanurtam hridastraya. Hridastraya. All the ischemic pathologies manifesting in the brain due to a problem in the heart, due to a problem of atrial fibrillation, due to a problem of multiple srodha is mentioned in Avadandraga only. That is why the treatment of Avadandraga is always so what? Srodho Shodaga. Tishnanasya, Tishnantana only. So my concept is all the emerging diseases, please follow Avadandraga. I am sure after 5 more years, nobody will read Patchagada because everybody know Patchagada without really knowing it. Please go to other diseases like Siragraha, Avadandraga, where you are getting organ to organ link. We always tell that Hridayam, Siru, Vasti, etc. Trimarma. The best sloga to bridge this Trimarma, Hridaya and brain is always the Avadandraga. So that is my initial thoughts. There are so many things to say, but time is not there. Please, madam, next slide. Clinical manifestations, Sapnya Lakshana. These are the sensory clinical features. Cheshta Lakshana, Manasiga Buddhi related Lakshana, and Shaga, Marma, Koshta related Lakshana. This is very important. When you are getting a diagnosed Parkinsonism, the latest research is telling that minimum 12 years back the pathology started. We are getting the pill rolling tremor, we are getting bradykinesia, we are getting lead pipe rigidity and postural difficulty, then only we tell it is Parkinsonism. But the latest research is telling that 12 years back the pathology started. That is what is the Sanjayam, Pragobam, Prasaram, Sthana Samsarayam, Vektam. Only when there is Vekta, we tell that this is going to be Parkinsonism. So what I am telling is, you are getting Shaga, Marma, Koshta related Lakshana. That is the Doshagadi from Koshta to Shaga. I am telling you, Koshta, Doshagadi from Koshta to Shaga, only a theory question. After 45 years, you do periodical, episodical Shodhana for all the patients who are in Vada Prakriti, because they may be in the stage of Prasara. They may be going to the stage of Sthana Samsaraya. Never try to treat Parkinsonism with the Kabigachu Churnam when they manifest it. You try to give the that is why it is clearly mentioned in the sloga. Sneha Klina Koshtaka Daduga Va Srodo Lina Echa Shaka Asti Samstha. Dear doctors, Echa Shaka Asti Samstha. Dosha Sedaiste Trivigritya Koshtam Nida Sammek Shuddhipur Nirkriyende. That should be done in very early days, minimum 12 years back. So then only you can, because we can never tell how Vada is getting Chaya, we cannot see. Somebody will tell I am getting gas trouble, so Vada Chaya. That gas trouble is not this Vada, that is something different only. Vada Chaya, Vada Prakopa, Vada Prasara, everything is here only. For that you can prescribe Gandharvastha Kashayam and Kingvajava Jurnam. This Madhyama Roga Marga Gada Vada Chaya Prago Prasara is very much difficult to understand. So, anticipating the Vada Prakriti people, anticipating the Vada pathology in the Vada dominant age, Purve Vayasi Madheva, Tat Prayojyam Jitatmanaha. The word is there. Everybody cannot apply it. Every doctor will not be. I think the patient should be Jidatmana, the doctor should be better Jidatmana. Otherwise, so many doctors are there. What they are claiming for the last 25 years is my patient. Why? Not getting any benefits. They are claiming, no, he will come to me only because I will not allow him to go to anybody else. So that you never do, you always educate the patient and do the episodical preventive techniques, then only you can prevent all these diseases. And when there is clasp knife rigidity, when there is pill rolling movement, no treatment at all, because in Madhyama Roga Marga, Vada is Vekta. Once it is Vekta, there is only next stage Bhedam, where Upadrava will be there, nothing more. Okay, next please. The initial words, again still we are in the initial words only. We are quite confident in classical Vada Vyadhi, but Ayurvedic neurology spreads beyond Vada Vyadhi context. That is my important message. So let us have a closer look for a wide vision. Okay, next. The one-line poem on Vada. I always tell this slide. The one-line poem on Vada. You are so dynamic and you have to be. Is there any poem like this? No. Vayus Tandra Yandradara we are telling. Va Gedi Gendayo, we are telling us the Nirukti, the one and only sloga which I respect in the entire Vada Vyadhi, because it is mentioned in the Susradam Vada Vyadhi Nidanam, Ashugari Muguschori Pakwadhana Gudalaya. My dear junior doctors, please go and read Sustruta Samagita Vadavyadi Nidanam. Sustruta, being a surgeon, the very first chapter is Vadavyadi, not Jora. No, Sustruta is a surgeon. Basically, the first chapter is Vadavyadi only. He never talks about Jora, and the sloga is like this only. Ajindya Virya Doshanam. Ajindya Virya, nobody can predict. Then how Gopakumar will predict? Ajindya Virya Doshanam. Neta, Roga Samuha Rat, Ashukari, Muhuschari, the Kavida you see, Ashukari, Muhuschari, Pakwasya Gudalayam. He resides in the Pakwasya and Guda, not in the cerebellum, etc. Pakwasya Gudalaya. That is why your wonderful slogan I have seen down in the Rangoli, Urda Mula Madashagam, Ishaya Purusham Vidu. Mula Praharina Tasma, that word is important. So that is, you are so dynamic, Vada is so dynamic, Ashugari, Muguschari, Pakwasya, Gudalaya is the concept where you can treat most of the Vada Vedis successfully. Next. So an ideal professional, my humble request to my junior students only, you develop your head, you develop your heart, you develop your hands. Because the improvement of all the three will make you an ideal individual, the head with a thinking capacity, cognitive domain, your head, not the patient. And next is your heart. You should always love the patient, then you will never get abadandraga. Okay? And then you will develop all the skill of examining a neurological patient, somebody who is having the samyak yoga of head, heart, hand, 3H, he will be the ideal professional in Ayurveda to deal multiple neurological issues. All the three are equally important. Next. So now let us join the clinical journey through the head, heart and hand. We are discussing with the head, heart and hand. Madam, please click the hand. There is a video attached. Okay, click OK. Click in the middle of the slide. Okay. Once again click. Okay. See, there is no audio. This is a patient admitted in Government Ayurveda College, Kannur, Pariyaram, General Ward. And this patient had lacunar infects. And she is trying to talk, but she is not able to talk with emotional disturbance and aphasia. The pathology was lacunar infact. Lacunar infact is the pathology where there will be less than 0.3 millimeter infaction in the frontal lobe. And this minor Sushma Srodoroda resultant in the speech and emotional, since it was in the frontal lobe, there was emotional, actually audio output was needed. I will copy the video for you because then you can see how difficulty she is facing with the talking. It is very difficult to get the talking, and then you can see it was identified as Egayamam. You know Egayamam? Ardidam. Ardidam is the pathology, and we added the treatment of Ardida and Ayama. My dear doctors, Ayamayor Ardidavat. We never respect that slogan because teacher never asked in Viva. Ayamayor Ardidava. The treatment of Ayama and Ardida are very much important. We combine the treatment here only, together here only, and the best medicine we have given was a Bunimbadi Kashayam. A Bunimbadi Kashayam which is mentioned in Kushtaroga Chakilsa because it is indicated in Supti. And I always believe that wherever there is Supti, there will be an elementary contribution of Kapha. Without Kapha, there is no question of Supti. You go to Shudraloga Prakarana, Vaino Dijida Sleshma, Tujam Prapti Visishtadi, Tadastuk Jayade Pandu, Krame Nacha Vichedana Sa Prasupti. Are you getting me? This loga is from Shudralogam. And Tojam Prapti, which is very slowly causing the Srodoroda. Lacunar, in fact, is nothing other than a condition where you are getting a Sushma Srodoroda. Bunimbadi Kashayam contains all Kapha Vilena drugs. And later Ballada Gurdam was given. Kalyana Avalekam, patient got considerable improvement. And she was able to tell, I am coming from Srigandapuram. Srigandapuram is a place in Kannur, so that was the case. So please close the video and let us come to the PowerPoint. Now I am not going detailing. These are the commonest cases attended by Ayurvedic doctors in our hospital. See, I am not going for very rarest of rare disease, only common clinical condition. Cerebrovascular accident, you know, degenerating disease, the area of discussion, demyelinating disease, infectious pathology, movement disorders and peripheral neuropathy. These are the major area. I will share some experience from all the group. Because time is very less, I will share some experience from all the group. Even though there has been enough discussion in degenerative disease, I am limiting it. I will be giving importance to other areas. Next. And then, madam, please, previous slide, please. You convert these 6 pathologies into the modern concept of Ayurveda, you will be getting some more pathology. Avarana at multiple level. One important clinical suggestion I have to make, Avarana is never a static phenomenon. What is the Ayurvedic people's understanding? Avarana will be here in this side of the stage and Dadushaya will be there. In Avarana, always do Langana. In Dadushaya, always do Brahmana. I am telling you something different. Avarana is never a static phenomenon. Avarana is a dynamic phenomenon. Avarana will come to Dadushaya. And Avarana will come to Dadushaya very slowly only. Sometime in the first 1/3 of the condition, Avarana Chikitsa will get results. Then there will be a stage, almost Avarana removed and Dadushaya started, you will not get any results. I am telling you, Avarana is 50% over, Dadushaya is 50% there, both are there. Which medicine you will give? Then you will not be getting some result. There is a reference, Vyathyasa Chikitsa. Vayo Pittavarde Sida Mushnam Ja Vyathyasal Karayed. Sarpur Jeevaniyam Ja Payed. A limited options are there. And after that, there is no contribution of Avarana, purely Dadushaya, you do Belya. But in that stage, it is very difficult to take the drug to the target because the drugs will be having minimum action. So I am telling you, Avarana is never a static phenomenon because we have done some theses in my department of Roganadana in Kannur and we got some very wonderful result which we never expected in some stages. The hypothesis attributed was when Avarana is strong enough with the very Kapakara Chikitsa easily applicable, we will be getting more result. When Avarana is getting reduced very close to the Dadushaya, the treatments are comparatively less. Uddartana, Dhanyamladhara, Silajadu Rasayana. I am listing 1, 2, 3. Uddartana, Dhanyamladhara, Silajadu Rasayana are the important medicines in the first 30 degree of Avarana. And when Avarana is coming to nearly the middle level, Bhalladagam, because Bhalladagam is a drug which is equally Dadu Shuddhikara and Belya and Medhya. Are you getting me? Bhalladaga's contribution is, Bhalladaga is always Vibandhahara. It will remove Avarana, but it is Belya, but it is Medhya. Kaphajostina, Rogostina, Vibandhosti Yastana, Yamna Bhalladagam Hanyad, Shikram Agni Bela Pradam. So in the middle area, I am telling you 40 to 60, that area where Avarana, Dadushaya exist together, you think about Balladaga or the same group. And after that, it is only Dadushayam, you can do whatever which is getting result, whatever getting that is minimum only. So my point is only point, never think that every time I will be giving Avarana Kara. If you are continuously giving Avarana Kara, you are creating Dadushaya. Am I right? Yes or no? You are continuously attacking with Avarana. Avarana, go away. Quit India. Avarana, quit my body. What will happen? All Ushna, Tishna, Rusha treatment will be removing the kapha and you are getting Vada Prakopa. In every classical Ayurveda, Acharya always reminds us that whenever there is an excessive Lengana, Vada Prakopa, take preventive steps for the anticipating Vada Prakopa. You know Vada Rekta? Vata Rekta is a disease where there is Avarana. What is the treatment? Vata Shondino Rectum Snigdasya Bhikishoharet Alpa Alpam. What is next word? Palayan Vayum. You keep an eye on the Vata. Never simply do the Rekta Moksha like that. So my opinion is Avarana is a static phenomenon. That is wrong. It is always dynamic. Dadushaya, specific Dadusara. Specific Dadusara. What is Dadushaya in Ayurveda? When somebody is getting a reduced muscle bulk, we will tell Dadushaya. Dadushaya is a very wide, I think we should not use the term. Whether it is Rasashaya, Rektashaya, Mamsashaya, Medusaya, specific level. In Rektasara Kshayam, what we are telling? Rektasara Hinada may be anemia, thrombocytopenia, leukopenia. Am I right? Rektasara Hinada may be anemia, maybe thrombocytopenia, maybe leukopenia. Thrombocytopenia will manifest as rectavitham, bleeding. Anemia will manifest as pandu. The treatments are different. So, Sara Hinada or the change in the Dhadu Sara should be very specific. Then Dhadu Paga with the Nija Agandu background, that is the myelitis, transverse myelitis, all the condition, tuberculous meningitis. We treated a patient with the tuberculosis and then leading to meningitis and then Patshagada. tuberculous meningitis with Pakshagada, the treatment was selected more from Rajayashma, less from Vadavyadi. The more treatment was selected from Rajeshma, nothing from Rajeshma, Shatpala Kridam like medicines. Sa Pippaligam, Sayavam, Sa Kulattam, Sa Nagaram, Sa Dadimam, Samalagam, Snigdha, Majam, Rasam, Pibed. Prescribe. All the medicines are available. I am telling you, all the medicines are available. Sa Pippaligam, Sa Yavam, Sa Kulattam, Sa Nagaram, Sa Amalagam, Sa Dadimam. You do the cross section of that yoga, please. Pippali, the number on Rasayanam, Yoga Vaki, bioavailability booster. Pippali. Yavam Kulattam, the best Kapagara drug. You are always talking about Yava and Kulata in all Sandarpana Vigara. Sa Yavam, Sa Kulattam, Sa Nagaram, the biological booster, the Dibana Badana drug. Then second two drugs, Pitta Shamanam. We never talk about Pitta Samana in brain. And the second drugs are Dadimam and Amalagam. See the engineering. This yoga is mentioned in Rajayashma Chikilsa. My dear students, please read it 100 times. Sa Pippaligam, Sa Yavam, Sa Kulattam, Sa Nagaram, Sa Amalagam, Sa Dadimam. All the drugs are available. Snigdha Majam Rasam Pibed. You prescribe with Aja Mamsa Rasa because Mamsa Rasa is the number one to improve the Belam. Belam, Helam, Doshagaram, Param, Tacha, Belapradam. That is mentioned in the concept of Mamsarasa, Snigdha Majam, Vigara, Shat Nivartande, Rajayashma. So that was the treatment adopted. Yavam, Kulattam, Dadimam, Amalagam, all the medicines are given in Ajamam Sarasa as Mamsarasa, followed by Mustadi Yavanavasti, again in Ajamam Sarasa. So that is the unique concept of Ayurveda. You break the chapters and go to other area. So this is the Dhagandu background. And Chalana Vishamada. Very important. Chalana Vishamada, you are getting the balance of Sthira Guna of Kapha and Chala Guna Vada in the body. I am telling you, Sthira Guna is brake, Chala Guna is accelerator. Sthira Guna, Chala Guna. You know, when we all talk about Kapha, we always give importance to only Snigdha Guna only. You think about Kapha property, please tell the sloga for Kapha. Vada Vyadi, tell the slogas for Kapha Guna. Snigdha, please, louder. Snigdha, Shida, Guru, Manda, Slashna, Mrisna, Sthiraha Kapha. The first property is Snigdha, the last property is Sthira. Snigdha can cause an Ubalepada only. Snigdha can cause a vascular endothelial dysfunction. Snigdha can cause a problem of the atherosclerosis. But Sthira will be leading to hardening of the artery. You will be getting a Kadinam Stimidam permanent space occupying lesion. So my concept is Sthira Guna will always cause a brake and Chala Guna will always cause acceleration. The balance of Sthira Chala Guna is normal movement. When my Chala Guna is more, I will be having uncontrolled movement like this. We call it as Akshibatye Shakshabhagam. When I am having Sthira Guna, no movement at all. I will be having like this. So the balance between Sthira and Chala Guna, the balance between Vada and Kapha, if it is broken, you are getting Chalana Vishamada. That is what is happening in all the Korea, all the involuntary movements, and even in the Parkinsonism. Parkinsonism is also coming under the spectrum of the movement disorder. And finally, the minor tendon disorders, peripheral neuropathy, that is coming under Upadadu Pradoshaja. So these are the major cases we are getting. Next. Now it is time for discussion. I will be discussing only next. Focusing Avarana, my dear doctors, Avaranam, Doshanam, Samsarga, Gedi Nirodha, Avarana, Margarodha, Avarana Sangha. This is the most common definition in neurology. Avarano Margasya Rodha. Marga can be functional, Marga can be biochemical, Marga can be structural. When you are getting a thrombus in the middle cerebral artery, MCA, it's a structural. Whenever you are getting a block in the synaptic cleft of the neurotransmitter acetylcholine, it is functional. That is why there is always functional and anatomical type of Margarodha. Both are applicable to Avarana. This Avarana will be leading to improper functioning of Pranavayu, Avalambaka Kapha and Sadhaka Pitta. I am telling in neurology. Pranavayu, Avalambaka Kapha and Sadhaka Pitta, the Avarana will be causing an alteration which will be leading to new diseases according to the current scenario. Next, madam. Next. So this is the most popular Avarana, you know. Next. So there can be Avarana will be leading to a Sangha, and when there is a Sangha, there are two possibilities. It will be a partial Sangha, it can go, it can pass through. If there is a very total Sangha, Vimarga Gamanam. That is very important. You are getting hydrocephalus, you are getting all the pathologies of Arnold-Chiari syndrome everywhere, you are getting Vimarga Gamanam. When there is a Sangha, there will be a Vimarga Gamana. That is always happening in cerebral edema, hydrocephalus, everywhere. You are getting the accumulation of fluid in the other sides. Next. So my next slide is very important for your doctors. Avarana from text to bedside. You read Avarana in the text. A-V-A-R-A-N-A, Avarana, finished. But you understand these concepts when you go to the bedside. Avarana means inhibition. Avarana means retardation. Avarana means delaying. Avarana means obstruction. Avarana means suppression. Avarana means congestion. I don't know the remaining. Next day I may be adding one more point. There are multiple meaning for Avarana in different dhadu, different sara, different roga marga. Inhibition may occur in the endocrinology. Retardation may be occurring in the nerve conduction. The chalaguna across this snayu, if it is attacked by mandaguna vada, you are getting NCV low. Nerve conduction velocity low, it will be leading to supti, something like that. And you are getting delaying, you are getting obstruction, suppression, congestion, all are our. So anilomada, all movements, all direction. The word anilomada means the programmed movement of vada in any anatomical site. My own definition. The programmed movement, the prefixed movement of vada in any anatomical srotas is called anilomada. If there is any change in the programmed movement, we call it as pradilomada, which may be manifested as edema or something like that. Next, we need not discuss about stroke because it is something different the topic. Ischemic stroke, hemorrhagic stroke. Ischemic stroke is Sangha, and there can be further Dadushaya and degeneration. Next. Then you are getting risk factors, diabetes mellitus, high cholesterol, cigarette smoking, hypertension, atrial fibrillation. I included this slide to tell you two things. Prameha and Vada Rekta are the next two diseases which are to be read together with the Vada Vyadi. In Vada Rekta, it is completely the issue of Rekta Margam Nihandi. Rekta Margam Nihandi. In certain conditions of obstruction, we prescribe Madhu Yashtiyadi Thailam mentioned in Vada Rektam. Madhu Yashtiyadi Thailam is indicated in Avarana Chikilsa, but that Avarana most of the time we will discuss only in PVD. But you can think the same Avarana in the Murdavaha Sira, and next is Prameha Chikilsa, Shilajadu. So my dear doctors, Madhu Yashtiyadi Thailam from Vada Rekta, Shilajadu Prayogam for Prameha can be judiciously applied in multiple Vada Vyadi. There is a wonderful reference to Shilajadu in Prameha, Subhavidam Sarajalais Tulam Pitwa Silodhaval, Sarambuneva Punjano. You prepare the Shilajadu in Asana Kashayam, Khadira Kashayam. Are you getting me? Asana Kashayam, Khadira Kashayam, both are Pramekakara, Kleda Shoshaka. Kleda will purify the blood. Kleda will reduce the LDL. Kleda will reduce the possibilities of atherosclerosis. Rektagada Kleda will always cause narrowing of the lumen. And that is why you prepare Shilajadu in Asana Kashayam or Khadira Kashayam. My humble point is, read Prameka Chikilsa and Vada Rekta Chikilsa together with the Pachagada, because nowadays you are getting multiple stroke associated with all this pathology. Next. These are the different area. Next. First ischemia, then infarction. That is very important. Whenever there is an ischemia, it will be going to infarction. This is the sloga. Which sloga you remember now? The best students will tell. Which sloga from Ayurveda you remember? Ayurvedic text don't have pictures, unfortunately. Which sloga? Anybody? I had given the sloga in the very first 5-10 minutes. Louder. Absolutely right. Rekta Margam, it is clearly mentioned that, you can see that Murda Dhara Sira, Rutshasa Krishna, the black area which is indicating the infarction. Rekta Masritya Pavana, Kuryal, Murda Dhara Sira. Next time when you read Ashtanga Hridaya, there will not be any picture, but picture will be in your mind. Am I right? Yes or no? Your answer will be, sir, Vada is Amurta, no? So there is no picture. you are out of the signal. Okay, no, you would always maintain the signal in the body only. So this is the sloga, Stiragraha. Stiragraha, you can see there is a block, Rutshasa Vedana Krishna, so Asadhyasyal Stiragraha. If Vagbada is alive now, he will tell this may be equal to Stiragraha. Next. And you can see infaction will be seen. This is an MR, this is a CT scan. You can see this dense structure is the infaction, that is Dhatu Bhagam. Even in MRI, it is Krishna Varna. Sorry, even in CT, it is Krishna Varna. You know what is Vada Vriddha Lashana? Vada Vriddha Lashana, very fundamental. Dosha Dhatu Maladi Vijnaniyam Ashtangradayam Sutra Sanam, 11th chapter. Vriddhastu Gurude Anilaha Karsya Karshnyam. 2 words enough. Let us wait. So whenever there is Vada Prakopa, Karsya. Karsya means the structure will be minimum. There is atrophy, dystrophy. Karshnya means blackishness. So even in CT also, sir, MRI, so CT also, Vata Prakopa will manifest as black only. I am not simply telling. So now next time when you are getting a CT ride, Karsya and Karshnya in the Uttamanga, Kabasthana, Vata Prakopa. That should be the Ayurvedic approach. You write K plus and K plus. If they are writing that it is CVA, we will understand it is cerebrovascular accident. In a city, you are writing KA plus and KA plus. No neurologist will understand. They will ask you. Then you will tell, it is my Bible. Karsium, atrophy. It is my Bible. Karsium, destruction and necrosis. Then they will study Ayurveda. Am I right? No? Yes or no? So write in Ayurveda only, then only talk in Ayurvedic neurology. That is why any fundamental principle is applicable in microscope, biopsy and imageology. These are the extended pratyakshas. I believe these are the extended pratyaksha. The Sushma Ayurveda told no Sushma Krimi. Ayurveda told Amashe Krimi, Pakwashe Krimi, Bahya Krimi and Sushma Krimi. He told Agojara, but he named them. You know, so many beautiful names are available for Krimi, even though Agojara, how he named? You just ask Susruta how you named without seeing it. Now, without seeing with the naked eye, we are telling no, leptospira causes elipani. You are not seeing it, no, you are believing, because you are showing through microscope. So these are the extended pratyaksha pramana only, you are getting hemorrhage in. So in a CT, the infact will be appearing as blackish shadow and you are getting a whitish shadow in hemorrhage. Basic understanding. Next. Next. So thrombotic stroke and embolic stroke are coming under the avarana and later it will be leading to Dhatushraya. Next. The impact will be Grihitvartam Tanorvayu Stirasnair Vishoshija Pakshamanyadaram Hande. The typical posture of the Pakshagada patient will be like this. Next. So this was the case which I discussed in the earlier. You know, the speech difficulty, difficulty in walking, emotional disturbance, lacunar infact. I think the video we have seen. That was the patient Charya, and with the speech difficulty, difficulty in walking, weakness, that was a lacunar infact in the frontal lobe. Any pathology involving the frontal lobe, there can be the possibilities of emotional disturbances too. Next. So this is the picture, lacunar infact in the left frontal lobe. You can see very minor structures are there, where frontal lobe lacunas will behave as avarana only. Next. So this is small, what is lacunar stroke? Small subcortical infact, 0.3 to 0.3 centimeter, 0.3 to 3 centimeter diameter due to hypertension. Hypertension will be leading to minor hemorrhagic and then infarction in the frontal lobe. That is lacunar infact. The patient you have seen in the video. Next. So this is my concept, Siras Nayur Shosham, CVA, cerebrovascular accident versus Siras Nayu Shosham. Sira represents vascular compartment, Snayu represents neurological compartment. When Sira is obstructed, you are getting Snayu Shosham. So that is CVA. Next. So that is why I am telling why ignore Sira Graha, basic pathology of Ayurveda. We always, all the taliolas are always, you have seen, kept binded, no? All the pictures of taliolas are like that. Rarely only you are getting viscery appearance, viscery like. It is kept only Sangha in taliola. You open it and read it and explore. Then you will see what is Siragraha in Ayurveda, basic pathology only. Next. Then some thoughts of Samprapti, Rasa, Rekta, Dhadus and Srodhas. Very important. That is why Rasa Prasadana Chikitsa is needed in stroke management. Rakta Shuddhikarana treatment is also needed in stroke management. Actually, there are no dushya mentioned in Pachagada and other conditions. You are getting no dushya in any Vada Vyadhi. Are you getting? You go through the entire Vada Vyadhi, there is no dushya mentioned in terms of Dadu. You are getting Amavada, something like that, but you are not getting, you take Gridrasi, you take Ardida, you take Pachagada, Avatandraga. There is no Dadu. You are getting only Sirasnayu, Kandara. Sirasnayu, Kandaras are the operating instrument and the tool which is behind the pathology is Rasa or Rekta. When there is a Rasa Dushti, there will be Srodo Roda. What is Rasa Pradoshaja Vyadhi? Asrada Jarjishyasya, Asrada Jarjishyasya, Arasada, everything. Rasajnanam, Asrada, Hillasa, Sangamardam, Srodorova, Clipium, Sada, Krishangada, everything is coming under Rasadushti only. So my point is, Rasabaha Dushti and Rekta Dushti are equally applicable in the Samprapti. Relation with the other organ and marma, especially kidney. Especially, the Hridayam, Nabi, Vasti, I believe the word Vasti is more applicable to renal apparatus because most of the renal hypertension, etc. are having a positive impact in the neurology. And subdivisions of Vada, Prana and Vyana. Prana is mainly neurological, Vyana is mainly cardiological. And Prana, Vyana, Samsarga can be easily evident in Avadandraga where it is clearly mentioned on sentence. Ashnuvida Muguswastyam, Muguraswastyam Avrate. You feel in your brain. You never read it. Feel in your brain. There is a sloga mentioned in the Avadandraka Chikilsa. Ashnuvida Muguswastyam, Muguraswastyam Avrate. What is the point? Once Avrata, Aswastyam. Once removed, Swastyam. Transient ischemic attack. TIA only. That is due to the any pathology in the heart, you are getting a partial incomplete consciousness for some time. Ashnavida Muguswastyam, Muguraswastyam, Avrate. That is why you are getting Gede, Vege, Bhave, Swastyam, Sarveshu, Akshepageshu. The concept is very much important. So Prana represents the neurological functional anatomy and Vyana represents the cardiological anatomy and functional anatomy, and Prana Vyana axis is always maintaining Hridaya and cerebrum. Cordis and cerebrum both are controlled by the same phenomenon Vada only. Next. So the Uttamanga, the another important point, my dear doctors, you are getting all the Srodo Dushti in brain. Adipravarti, Sangha, Sidagrandi, Vimarga Gavanam. You are getting Sangha in the form of thrombus. You are getting Sidagrandi, that is aneurysm. The different aneurysms occurring in the brain, atriovenous malformation occurring in the brain are coming under Sidagrandi. Or a Sidagrandi is only varicosity. No. Sidagrandi occurring in the Uttamanga is nothing other than aneurysm. AVN, atriovenous malformation. What is AVN? Normally there is no communication between the artery and the vein. But in certain conditions, the artery and vein will be having abnormal communication. We call it as AVN. There will be bundle of structures which behave as Sidagrandi, and that is why it is there. And Adipravarti, you are getting hemorrhage. Vimarga Gamana, you are getting edema, cerebral edema. So my dear doctors, all the four Srodo Dushtis are equally present in Vada Vyadhi. That is why Vada Vyadhi is the first in the Ashtamahagada. This AVN, you can see the tuft of bundles of arteries and veins combining together. This will rupture. AVN will rupture and which will be leading to subarachnoid hemorrhage. So rupture of AVN, Sidagrandi will be leading to Vimarga Gamanam. See, I think you are getting. Sidagrandi itself is Sangha. Sidagrandi is the morphological Srodo Dushti, and then that may rupture leading to Adipravarti and subarachnoid hemorrhage. See the link between Srodas to Srodas, Dushti to Dushti. That is why Vada is so much dynamic. Next. And let us think more, thrombus and embolism, Rasa, Rekta, Medo, Dushti, that is why Prameham, Medo, Dushti, Prameham. Reduced cerebral blood flow, that is Vyana Vada Chayam. Reduced cerebral blood flow, that is Vyana Vada Chayam. Ischemia and infarction, Srodo Vigrdi and Dadushaya. Hemorrhage, Vimarga Gamana, cerebral edema, Abhishyandana. These are the multiple pathologies occurring in the disease in the very first phase. And you can see, Avarana leads to Vada Pratilomada. Our treatment should be to minimize the Avarana because it will not go to the Vada Pratilomada stage. Next. cerebral ischemia, Srodoroda, explore Murcha Sambrapti. The very best sloga I like. Rajo Moha Hidahara Parasyasyu Strayogada Rasa Asras Chedana Vaki Srodo Roda Samudbhava. See the three Srodas mentioned in the Murcha. Rasa, Rekta, Chedana Vaki. Rasa, Asras, Chedana Vaki, Srodo Rodam. That is happening in every type of neurological disease. That is important. Occlusion of Rasa, Rekta and Chedana Vaki, Srodasas will be leading to Murcha. So these all comparisons are given for the Avarana concept in the early phase of Ayurveda. And on treating the Avarana successfully, it will never go to the degeneration. Thinking about degeneration only in degeneration is always not at all good. You think about degeneration in the Avarana stage. Otherwise, it is equivalent to keeping the fertilizers in the last stage. You know, you do the, you anticipate Dhadushaya in Avarana phase. All Avarana will be leading to Dhadushaya only. Next. Dig the signs and symptoms of Sannyasa, Vak, Deha, Manasam, Cheshta. Sannyasam is again Vak, Deha, Mana. All the body compartments, all the mental compartments, all the Indriyas are affected. So that is from Sannyasa. Next. So, one important question for the treatment purpose is Kevala Vada and Dhadushaya Shagada are one and the same. This question is to you only. If no, what is the pathology of Kevala Vada? Hypothesis, in Kevala Vada, Vada Goba occurs first and thereafter Dhadushaya happens due to shorten of Dhadu by the aggravated Vada. But in Ksheja, Dhadushaya occurs prior to Vada Pragoba due to Srodoroda or Avarana. So the treatment always vary. Very important point in deciding and formulating the treatment. This is to be always kept in your mind. Kevala Vada, Dhadushaya, whether it behaves equally or differently. Next. So Avarana by Dhaduvrti, SOL, space occupying lesions in CNS, different tumors in CNS causes mechanical and functional obstruction to Vada. Guru, Stira and Grathana properties of Kapha are relevant. Proper Sambrati Vikatana can delay the growth and thereby the treatment of Avarana. Kaphaja Gulma Chikilsa is important here. We are always recommending Kaphaja Gulma Chikilsa in such a space occupying lesion. My dear doctors, let us go together to the Gulma Chikilsa by Vagbada. It is very clearly mentioned that Krita Moolam Mahavastu Kadinam Stimidam Guru Kapha Gulmam Jayetyashu Shara Arishta Agni Karmana. The first morphological description of a lesion. Krita Moolam. What is that? Deeply seated. Krita Moolam. Mahavastu. Palpable. He is telling a lesion. Krita Moolam Mahavastu. Palpable. Kadinam. Hard. Stimidam. Fixed. Not movable. Then this Kapha Gulma can be treated by Kshara, Arishta, Agni Karmana. You cannot do Agni Karma in brain, but you can give Agni Moola drug, Chitraga and Palladaga. Chitrago Agni Sama, Palladago Agni Sama. And both are the drugs which are indicated when there is a strong Kapha Dushti. And all Upavishas are indicated in such a condition. Chitraga is coming under Upavisha. Palladaga behaves as Upavisha. All the Vishas are Tishna, Ushna, Vivayi, Vigashi, Sushma. See, any drug which is Sushma can only go to the brain. Tishna, Ushna, Vivayi and Sushma drugs like the Upavisha group, Palladaga, Chitraga can be given in conditions of the space occupying lesions in CNS because both are Rasayana, so it will not damage Dhadusara. Chitraga and Palladaga are Rasayana, they will not damage the Dhadusara, but they will cause the destruction of the Kadinam, Stimidam, Kridamulam, Mahavastu lesions. Next. Again, you can see tumors, Kapha, type of multiple tumors are there. Again, the treatment is Palladaga Prayogam, Chitraga Prayogam, and Chitraga given in Takra is very much important. Chitraga given in Takra. I will tell one important concept from Arshas. There is a sloga in Arshas, Vada Sleshma Vigaranam Shatam Cha Vinivartade. Have you heard this sloga? Anybody? Now you are hearing Vada Sleshma Vigaranam Shatam Cha Vinivartade. It is mentioned in the context of the Takra Prayoga in Arshas. Is 80 Vada Roga, 20 Kapha Roga. 80 plus 20 Shadam. That is Vada Sleshma Vigaranam Shadam Cha Vinivartade. When you prescribe medicated Takra specifically with the Chitraga, it is clearly mentioned. That is my point. Next. Now the another area Dhatushraya already discussed, our own topic, that is degeneration. Next. Dhatushraya from text to bedside, infaction, degeneration, demyelination. My dear doctors, see the word infaction, degeneration, demyelination. The second D and third D are always Rusha Ushna Janita pathology. Rusha will take water, Shoshana, Ushna will take dry the material, Kavatshaya. The combination of Rusha plus Ushna will always lead to dehydration, degeneration, demyelination. Dehydration, degeneration, demyelination. Whenever there is the Amshamsa Kalpana, Vikalpa Samprapti with Ruksha Ushna Samsarga, Vadas, Rusha plus Pitta, Sushna together in a cell will lead to dehydration, demyelination and degeneration. Dehydration is not applicable here, but it is applicable degeneration and demyelination. You can very well address the treatment because Ruksha Ushna, the treatment is Grida only. Vada Vittottare Grida only. Next. So that is why in the motor neuron disease, I am not reading all the slides because you have heard enough. M&D, it is popularly degeneration. Next. You can see the level of pathology of the level of motor system in the body. Next. And this is the difference. You can see the wasted skeletal muscle. This is the snayu, this is the mamsa. Mamsavahanam srodasam snayu moolam tokcha. Am I right? You studied anatomy, but never give importance. Mamsavahanam srodasam snayu moolam tokcha. When the snayu is getting a wasting, you can see the result is seen in the mamsa, and then you are getting the mamsa sarahinata snayu shosha due to vada prakopa, that is ALS. Mamsa sarahinata snayu shosha plus vada prakopa, that is ALS in Ayurveda. Next. Next. You can see the muscles are thin or muscle wasting is there in the amyotrophic lateral sclerosis. Next. Dhatushraya, the clinical possibility, end product of avarana, decreased dhatogni function and dhatu sarahinata. This second word is important. Decreased dhatu agni function. Always empower the agni. We prescribe panchagola churna first, followed by Shatpala Grida or Induganda Grida. Then only we will go to the contemporary Vada Vepachikilsa for ALS. Always empower the Agni in the Kosta. Panchagola is the very important churna because it contains Chitraga again. Pippali Moola, Chavya Chitraga Nagare. Panchagola churnam in buttermilk for 5 to 7 days has normal dosage, followed by Grida Bana with the Shatpala Grida or the Induganda Grida. Again both contains the Pippali Moola, Chavya Chitraga, and then only the classical. So my point is decreased Dhatogni should be empowered in the management of ALS. Next. Fate of Avarana, ultimately Dhatushraya. Next. Case from our ward, a patient name Sudhakaran 50. The patient was from our ward, means my hospital Kannur. It was from there only. Patient name Sudhakaran, weakness of bilateral upper and lower limbs associated with fasciculation and wasting. Whenever you are getting fasciculation, Suryanam, where Suryanam is mentioned in Ayurveda, Ubadadu Pradoshaja Vyadi. Even before starting Charaka Samagita Chikilsa Sthanam, even before starting Nidana Sthanam Vada Vyadi, Charaka is telling that there is Ubadadu Pradoshaja Vyadi, Snayo Sira Kandarebhya, Dushta Krishnandi Manavam, Stamba Sangoja Kallipur, Grandi Spurana Suptaya. To me, the best slogan, a single line with all possible neurological clinical feature is Tamba, Sangoja, Kallipur, Grandi, Spurana, Suptaya, Ubadadu, Pradoshaja Vyadi. It's a very simple case of lower motor neuron. You can see duration 5 years, onset gradual, started as weakness. Next. And the importance of Vada dosha, we treated with the Shilajadu Rasayanam and we assessed using functional rating scale. Some of the parameters got improvement. There were 2 PG studies in Kannur College with the M&D. We got some results with the Shilajadu Rasayanam. Shilajadu was given for 21 days. Eka Trisapta Saptaham Karsham Arda Balam Balam. We selected the dose for Arda Balam. Arda Balam was rounded as 24 gram, morning 12 gram, evening 12 gram. It was given in the Kashaya, Sakadara the Kashayam. And we have given 21 days. We got improvements in certain parameters only, especially Vaksanga. difficulty to speech, there was some improvement, difficulty to write, some improvement were there, but there are parameters where there were no improvement at all. So I am telling you, MND can be treated to some extent by enhancing the Agni. The Rasayana selected was Shilajadu after giving Panchagola Churna and Shatpalagrada. Again, Udana Vada, Vak Pravarti is important. Dhyanavada, Gedi, Pranavada, Stivana, Nishwasana, Anna Pravesana. My dear doctors, see how beautifully we can accommodate three important vadas in most of the clinical features of MND ALS. Next. Next. Initial Kaba Goba in Kosta, Avarana Vada by Kapa, secondary Vada Goba, Anyonya by subdivisions of Vada, and Dadushriya. This was the discussed pathogenesis as per Ayurveda. Next. Anyonya Prana Avarda Udana, Udana Avarda Prana. Here the mutual functions are suppressed. One will inhibit other will inhibit Vada, so you are getting Anyonya. That is why Vaksanga, Stivana, Nishwasa, Anna Pravesana was affected. Prana and Udana are doing all these functions. Next. So MND, Medrashana, Stambana, Swarana, Mamsachosha, Bhaktaroda, Vaksanga, Swarasada. Leave it. Next. Next. So one more case which we treated, reading Jihva Stamba again. You know bulbar palsy? Bulbar palsy. There is a wonderful sloga in Ayurveda. I think the best reality sloga in Ayurveda. It is mentioned in the context of Vada Vyadhi only, Jihva Stamba. It is clearly mentioned. You follow me with the sloga. Vakvahini Sira Samsta Jihva Stambhayade Anilaha Vak Jihva Stambasatena Annapana Vakyeshu Anishada. Some of them you are remembering the sloga. Very good. You follow the sloga once again. The one and only sloga where the particular cranial nerve is named. Vakvahini Sira. Vakvahini Sira, it is Vak is the Karmendriya. We know the 12th cranial nerve. Whenever you are getting the hypoglossal nerve, Vakvahini Sira. It is the not Rasanendriya, Karmendriya, Vak. Vakvahini Sira, you are getting the genioglossus, palatoglossus are getting paralyzed, and Jihva Stambasatena. What is the clinical features are? Annapana Vakyeshu Anishada. Annapana means swallowing of liquid and solid food. Dysphagia. Vakyeshu means difficulty to speech, dysarthria. You go to the bulbar palsy, the two clinical features are dysphagia and dysarthria. Annapana Vakyeshu Anishada. Salute to Vagbada. Even with any neurological evaluation, with any MRI, he told there is a Vakvahini Sira. That is undergoing stambha, paralysis by Vada. I will tell the sloga again for your reading. Vakvahini Sira Samsta Jihva Stambhayade Anila. Next line is the bulbar palsy clinical feature. Jihva Stambasatena Annapana Vakyeshu Anishada. You know, this is my tongue. If the muscles of the tongue are paralyzed, the intrinsic muscles are paralyzed, there is no talking, dysarthria, there is no swallowing, dysphagia. So this is the sloga. If you are interpreting Ayurveda to a high level of modern neurology, Jihva Stamba is very mentioned with bulbar palsy. Again, the treatment was again very, very important. Shiraduma type of Nasya, and so Shiraduma external and Brahmana Nasya Vaksange. Brahmanam Vadaje Sule Surya Varte Surashaye Nasasya Bhage Vaksange. Again, Brahmana Nasya was done. Pradimarsha is important. I am telling you, you do Nasya for 7 days, 14 days, you stop it, patient may get discharged, continue Pradimarsha for minimum 21 days. Minimum, then only you will be getting some rest. This is Kaligalam only. My humble observation is, whatever drugs told in the Treda Yuga, Dobara Yuga, you always give double or treble. You give Avivatti Churna 15 gram, nobody will get any diarrhea. They will be getting constipation only. Because it is Kaligala Avivatti Churnam. I will write Avivatti Churnam bracket K, Kaligalam. So you give it 25-30 gram, nothing will happen. If something is happening, that Avivatti Churna contains 8 equal to the 8 drugs, that is reverse. Now I am really telling, so you always increase the drug, increase the dose, increase the duration. I will tell a case. I got a patient with earth paralysis. You know what is earth paralysis? ERB, the paralysis of the axillary nerve. The patient was not able to take the cup of tea and drink. We have done Dhanondaram Thailam 21 Avarti Nasya, and same Dhanondaram Thailam was given for 21 days. Then he could take the cup with half glass of milk. Initially, he was not able to even lift an empty glass. He was able to do, and the treatment was Ababahuga Chikilsa with Ubadadu Pradoshaja. Dhanandaram Thailam 41-21 Nasya, again extended for 21 days Pradimarsha, same Dhanandaram Thailam internal. Any peripheral nerve pathology, Dhanandaram Thailam Avarti is having very good importance because it is Nayugata Vada Shamanam. Peripheral nerve pathologies can be correlated with Snayugata Vada or Ubadadu Pradoshaja, Dhanandaram Thailam Avarti is Belya and Srodho Vishodaga. I mean, the Srodho Shuddhi in a peripheral nerve is the improvement of sensory motor transmission. Are you getting me? The Srodho Shuddhi in a peripheral nerve or axon is nothing other than the improved transmission of signals across that. The better transport of the action potential across that. The improvement of Chalaguna. A Snayu Srodho Shuddhi. Snayu is not a hollow structure. The Srodho Shuddhi in Snayu is better transmission of the signals. That is better Vata Anilomada. Dhanandaram 41 is Srodho Shuddhigara, Vata Shamana, and it is always Belya only. So that is the case. So bulbar palsy the same. Brahmana Nasya was given, Chidaduma was given, and Saraswata Arishtam, all the neuro degenerative medicines were followed. Next. So this is my humble advice. Avarana and Dadushaya are not airtight pathology. Just like you are telling Sonia Gandhi, Narendra Modi, Ummanjandi, Pinarayi Vijay. Not like that. Avarana will become Dadushaya and there is a always overlapping. We always tell Avarana will be here only, Dadushaya, Kaurava and Pandava. No. That is the wrong of Ayurveda. Everywhere we are told this is Ushna, that is Sida, this is Brahmana, that is Lengana. I will tell a simple thing, 1 minute. For you, for me, Brahmana and Lengana are opposite, no? Am I right? For the time being, it is opposite. I will show you how they are friendly. You just take a very big road of something. You write Lengana at one end, you write Brahmana at other end. Both are very... Make them a circle. What will happen? Lengana is very close to Brahmana. You see, Brahmhyastu Mridu. Only after doing Lengana, only you are doing all Brahmana. Only after doing Srodho Shuddhi, only you are giving all Brahmana. So when you are like this, a linear view, Lengana, Brahmana, opposite. A holistic view, I use the word holistic, whole view, Lengana, Brahmana, LB come closer. What we need is holistic view. Only after doing Lengana, we will do Brahmana. I will add one more story for extending your vision. We have done a study in Trivandrum College, Reveguna department. The rats were put into starvation. Rats, the experimental rats. And then the intestine was dissected. And what they could see is the intestinal epithelial cells are fourfold increase in their surface area. Why? A starved intestinal epithelial cells fourfold area increase because anything which is coming, it should be absorbed. That is an adaptation. There is no food, there is no absorption, so intestinal area increase. So when you are administering Lengana, you are enhancing Samana Vata. Samano Agni Samibasta Koshte Charadi Sarvada Annam Grihanadi from the intestine, not from here. This is Prana Udana will do. This is Annam Grihanadi different. Annam Grihanadi Pajadi Vivejayadi Munjadi is the function in the Annavaha Srodhas intestine. That will be, I will be stopping, that will be, I never thought about the bell, okay. So that will be there when you are able to do the Anilomana. So Avarana and Dadushaya are not airtight pathology. They can even coexist in same patient at different sites. Don't miss this possibility while doing the treatment. So there are so many things. I think only 61 slide, again 60 plus are there. I am not disturbing you. Whatever I have to conclude is, Avarana and Dadushaya will coexist in so many conditions. Avarana will lead to Dadushaya. Dadushaya is degenerative disease. Whether it is Parkinsonism, whether it is ALS, whether it is Alzheimer's disease, you identify it in the Dadushaya, you identify it in the Avarana stage only. Otherwise, there it will naturally become Dadushaya. Treatments are very, very, very difficult to get. Dadushaya will be the terminal stage. Kabigachu Churna, Rajayabana Pasti, Balladaga Krida, Chitrakarasayana, whatever thing you are doing, you do it in the Sthana Samsraya stage at least. If it is to be done in the Vecta stage, he will be coming to you with the Parkinsonism. He will be resting in peace with the Parkinsonism. So that is why Ayurveda only study Kriya Galas. In allopathic medicine, there is no Kriyagala, only Kalan is there. We have a Kriyagala. You can treat in Sanjaya, you can treat in Prakopa, you can treat in Prasara, at least you can treat in Sthana Samsarya, never take it to Vecta. Okay, then also do something, but if it is in Veda, there is less scope. That is the difference between an Ayurvedic doctor and allopathic doctor. Allopathic doctor identify the Sushma level. I am repeating, madam, only 1 minute. I am repeating the Sushma level avarana in any neuronal cell. Maybe the deposition of an unwanted metabolic part, that is due to the insufficiency of the Dhatogni. That is why Roga Sarvebi Mande Agnu. Otherwise, only Koshtagni is needed. You will never get a Parkinsonism due to Mandagni. Parkinsonism you are getting due to the deposition of a beta amyloid protein. That is Dhadugada Mandagni only. So protect the Agni. No Viruddhahara, no Vidakyahara, no Vishtambyahara. That is my slogan. No Viruddham, no Vidahi, no Vishtambi. You avoid all the 3 V because we care you. You avoid Vishtambi, you avoid Viruddham, and you avoid Vidahi because we want to care you. And that is my humble words. Identify the pathology in the Avarana stage itself. Never take it to the Dadushaya. Dadushaya reached very less possibility. So identification in the right time. You combine Ayurveda and modern. Take the help of modern medicines to understand micropathogenesis. So then we can definitely give a better quality of life. It is better quality. The patient who doesn't know his name, the patient who doesn't know who is he, the patient who doesn't know what is the inside, you can give some hope to them. So I am very much thankful to the Amrita School of Ayurveda, all the teachers, staff, especially my beloved Guru Nambudiri sir for giving me an opportunity to be here. And I am very much thankful to you for your Jnasa in the 1 o'clock where your Annavaha Srodhasi is Tishna and your Jnanavaha Srodhasi is getting some Mandaguna maybe. So I wish all clinical success in your future Ayurveda. Learn Ayurveda, love Ayurveda, live Ayurveda. Thank you very much.
Thank you, sir. Thank you for the energetic presentations and for sharing your clinical experiences. Now, we invite Dr. Ramesh N.V., Associate Professor, Department of Rasa Shastra and Vaisheshya Kalpana, to kindly hand over the memento. Thank you, sir.